Thank you for your commitment to Reynolds and most importantly for your commitment to contributing to a safe and healthy learning environment. We have all faced challenges over the past several months and your adaptability and support of Reynolds has been unparalleled. Reynolds Community College return to campus training is required for all faculty, staff, and students and contains important information about precautions Reynolds is implementing to protect the health of faculty, staff, and students during the coronavirus or COVID-19 pandemic. The purpose of this training is to provide all faculty, staff, and students returning to campus during COVID-19 with information necessary to help reduce the spread of COVID-19 within the Reynolds community. This training is designed to raise awareness about the COVID-19 illness and transmission, outline precautions the college has in place to reduce the spread of COVID-19 within the college community, review faculty, staff, and student responsibilities to reduce the spread of COVID-19, and to help you understand how you can protect yourself and others while on campus. We all play a critical role in maintaining the health and safety of the Reynolds community. Please follow this training carefully as it provides important information about returning to campus and the safety precautions that must be observed on all Reynolds campuses. Details about Reynolds' plans and precautions for returning to campus are outlined on the Reynolds COVID-19 response page found on the Reynolds website, reynolds.edu. This training, coupled with signage and your support, will help build a culture of adherence to public health and safety precautions to help protect the Reynolds Community College community. Individuals infected with the COVID-19 virus can become seriously ill or die. COVID-19 illness is caused by a novel coronavirus, one of the families of viruses that also cause the common cold, that is spread person to person through respiratory droplets containing the COVID-19 virus. Because this is a novel virus, the scientific understanding of the virus is still evolving. However, it is likely that COVID-19 exposure occurs most frequently between a sick individual who coughs or sneezes within close proximity to others, about 6 feet. It is important to note that the sick individual may not exhibit any symptoms of illness. Face coverings, sometimes referred to as masks, are one of the most effective ways to block droplet transmission between people. It is extremely important that face coverings be worn. Droplets containing COVID-19 virus can also contaminate and temporarily survive on surfaces. Individuals can become ill by touching a contaminated surface and then touching their nose, mouth, or eyes. Current research suggests that this type of exposure is less common than person-to-person exposure. However, it is important to maintain a clean work environment to prevent spread of COVID-19. The college is increasing cleaning routines to disinfect frequently touched surfaces. Where supplies are provided and available, faculty and staff are encouraged to clean work areas on a periodic basis. Most importantly, wash your hands frequently, practice good hygiene, wear your face coverings, and remain home if you feel unwell. These practices, combined with physical distancing, can slow the spread of COVID-19. Individuals who become ill with COVID-19 report a variety of symptoms, ranging from no or mild symptoms to severe illness requiring hospitalization. Symptoms of COVID-19 can include cough, shortness of breath or difficulty breathing, fever, chills, shaking, muscle pain, headache, sore throat, and loss of taste or smell. Other less common symptoms reported include nausea, vomiting, and diarrhea. Consult your medical provider if you experience any of these symptoms or symptoms that concern you, and do not come to campus. Symptoms typically appear 2 to 14 days after exposure to the virus. A person will remain infectious for up to 72 hours or 3 days after symptoms abate. Research suggests that individuals who have been exposed can be infectious even when they show no symptoms at all, also referred to as asymptomatic. For the protection of others, it is recommended that you take quarantine precautions if you suspect or know that you have been exposed to COVID-19. Do not come to campus if you suspect that you have been exposed to the virus. Contact your instructor immediately by telephone or email. If you are unable to reach your instructor, contact the Dean of Students at 804-523-5025. Quarantine means remaining at home, avoiding others and public locations as much as possible for 14 days after a suspected exposure. COVID-19 illness can result in serious illness or death, especially among individuals who are considered high risk. You might be considered high risk if you meet any of the following criteria. You are 65 years of age or older, have a compromised immune system, have a chronic health condition such as a serious heart condition, diabetes, chronic lung disease or moderate to severe asthma, liver disease, chronic kidney disease or undergoing dialysis, and or severe obesity with a body mass index of 40 or higher. This group includes faculty, staff, and students who are recognized as high risk per the CDC guidelines due to their own health conditions, as well as faculty, staff, and students who live with or provide care to a family or household member who is at high risk for severe illness from COVID-19. The college does not prohibit individuals with any of these conditions from coming to campus, but individuals who are at high risk are strongly encouraged to make arrangements to complete coursework online and minimize the amount of time spent on campus in order to reduce their potential exposure to the COVID-19 virus. Please consult with your healthcare provider if you have any questions about your health. When you are in close proximity to other people on or off campus, there is no guarantee that you will not become infected with the COVID-19 virus. However, the college is implementing a variety of public health and safety precautionary measures to help reduce the risk of transmission. Collectively, our actions can slow or prevent the spread of COVID-19, but we must all do our part. Reynolds public health and safety precautions include conducting a self-administered screening assessment of symptoms or contact with a known COVID-19 case or cases. Individuals who feel sick or are experiencing symptoms should stay home. Modifying instruction and work routines to reduce exposures. Implementing physical distancing measures in all campus environments. Mandating the use of face coverings, requiring safe distancing for all faculty, staff, and students in work areas and classrooms, increasing cleaning of college spaces, posting public health and safety signage, and erecting barriers between people in some areas to reduce exposure. There may be additional precautions implemented in unique environments or activities based on recommendations from the CDC best practices and specific requirements for these environments and activities. For example, campus recreation, cafes, and retail may have additional precautions that all faculty, staff, and students must observe. Plans for COVID case investigations are also being developed. Information about these plans and procedures will be released when more information becomes available. Instructional continuity plans are being developed to implement public health and safety precautions in our classrooms. Reynolds is modifying how we deliver face-to-face instruction to reduce the spread of COVID-19 on campus. Some of the ways that Reynolds is making classrooms safer is by reconfiguring classrooms to reduce classroom occupancy to allow adequate separation between instructors and between students in the classroom. Reduction in classroom occupancy requires the college to be creative in how instruction will be delivered in the fall. Additional online courses are being offered to account for reduced classroom occupancies. Naturally, these changes require academic procedures to be modified to account for the changes. Be assured specific instructions and academic continuity will be provided as registration, enrollment, and instructional plans are finalized. Faculty, staff, and students returning to campus will find many changes as a result of campus-wide efforts to provide appropriate health precautions and prevent potential spread of COVID-19. The primary way to prevent the spread of communicable diseases is through physical distancing, commonly referred to as social distancing. Physical distancing is the practice of maintaining distance between yourself and others to prevent the transmission of airborne droplets that might contain COVID-19. Social distancing in workspaces and classrooms was discussed previously. Social distancing precautions will also be implemented in college shuttles, common areas, and other environments throughout campus. Please observe signage indicating new occupancy limits and which spaces can and cannot be occupied. College shuttles will also have limited occupancy to allow separation between riders. Drivers are instructed and permitted to prevent riders from boarding a shuttle that is at capacity. We recognize that these precautions may create challenges and inconveniences. In accordance with CDC recommendations and public health and safety precautions, all students, faculty, and staff are required to wear face coverings whenever in shared offices, common areas such as hallways, classrooms, restrooms, and elevators, in all college buildings, and outdoors anytime physical distancing from others cannot be maintained. For obvious reasons, face coverings are not required when eating or drinking. Face coverings are also not required when individuals are alone in their office or workspace. If a face covering prevents communication with someone who is hearing impaired or a health condition is exacerbated by wearing face covering. If you believe that you are unable to wear a face covering for health reasons, an exemption may be requested. For staff, exemption requests must be submitted to Corliss Woodson, Associate Vice President of Human Resources at cwoodson@reynolds.edu. Reynolds Policy 311, reasonable accommodation will be followed. For students, exemption requests must be submitted to the Office of Student Accommodations at osa@reynolds.edu. Anyone entering college buildings without a face covering will be provided a disposable mask upon entry. Disposable masks may only be worn for one day and then must be placed in the trash. Any face covering worn for extended periods throughout the day should be laundered or hand washed after use using regular laundry detergent. Face coverings should be worn properly. Cover the nose and mouth from the bridge of your nose to 1 inch below the chin. There should be no or minimal gaps between the face and face covering. Face coverings must be secured with one or more straps. Wash your hands before placing your face covering on and after you take your face covering off, and be careful not to touch your eyes, nose, or mouth when putting your face covering on or taking it off. Please understand that some members of our community will have a medical accommodation or personal exemption from wearing a face covering. We should not assume that someone who is not wearing a face covering is not complying with this requirement. Rather, These individuals may have a legitimate reason for not wearing a face covering. To keep everyone healthy and safe as possible, we are enhancing campus routine cleaning with additional cleaning and disinfecting activities in all areas. Any space that has a higher level of use or occupancy will have a higher frequency of cleaning. High-touch areas such as door handles, light switches, elevator buttons, etc., will be cleaned following CDC and OSHA guidelines. Horizontal work surfaces, tables, desks, etc., will be disinfected in the same manner. We ask that all members of the Reynolds community provide additional assistance to the custodial staff by cleaning and disinfecting additional areas in your own personal space. This includes additional hard surfaces such as computer keyboards, desk phones, and other high-touch areas. Please keep your study, work, and living space clean and hygienic. Cleaning is just one part of a larger strategy to prevent exposures. It is an important practice, but your best defense against COVID-19 is good personal hygiene. Specifically, please be sure to wash your hands frequently for 20 seconds and avoiding touching your face, eyes, and mouth throughout the day. COVID-19 safety signage will be posted throughout campus to remind faculty, staff, and students of the health and safety precautions that must be observed, as well as new occupancy limits for classrooms, work areas, and common spaces. These signs are provided to remind the Reynolds community of the need for remaining home if sick, physical distancing, face coverings, good personal hygiene, and revised space occupancy limits. Anyone can unknowingly acquire and/or spread COVID-19. Everyone within the Reynolds community has a role to play in slowing the spread of this disease, protecting yourself and our community. Please help to maintain a safe and healthy campus by maintaining good health and well-being, get adequate rest, maintain a healthy diet and exercise, wearing a face covering when on campus, washing hands frequently throughout the day after leaving a group setting, after blowing your nose or coughing into your hand, and especially after removing your face covering. Reporting observed unsafe conditions to your supervisor, remaining home if sick or suspect exposure to COVID-19, and reporting suspected or confirmed illness to your supervisor, observing social distancing guidelines and public health and safety precautions. Despite our individual and collective best efforts, there is a risk of contracting COVID-19 as our region and nation begins the process of reopening our institutions, businesses, and country. It is important that we acknowledge this risk and take steps to prevent the spread of this disease. One of the most effective ways to prevent the spread of COVID-19 is to remain home when you are sick and report your illness to Reynolds so that we can track and work to prevent the spread of COVID-19 in our community. If you suspect that you are sick or have been exposed to COVID-19, stay at home. Most people with COVID-19 have mild illness and can recover at home without medical care. Get tested. It's important to confirm if you have COVID-19 so that you can take appropriate precautions and receive medical advice. It's important that you take care of yourself, stay in touch with your healthcare provider, and follow their instructions. Call your doctor's office before you seek medical care. If you feel you are experiencing a medical emergency, call 911. To reduce the spread of this disease, when you are sick, stay home, except to get medical care, avoid public areas, avoid public transportation such as shuttles, ride sharing, or taxis. Do not participate in group activities. If you must go in public, use a face covering. Notify your instructor or dean of students if you are not able to reach your instructor. Report your illness or suspected COVID-19 exposure is a key responsibility for protecting the Reynolds community and will assist in limiting further spread of the virus. Reporting guidelines apply to all faculty, staff, students, and contractors. Instructions on how to report COVID-19 illness are available on the college's intranet site in the HR Frequently Asked Questions. If you are diagnosed with COVID-19, you will be asked to identify anyone you have had close contact with during the time you have been infectious. The college must know if you become ill or suspect that you have COVID-19 in order to help others take appropriate precautions and to prevent the spread of the disease. Contact tracing is a disease control measure that prevents further spread of the virus by warning those who may have come in contact with an infected individual. When the college is notified of a suspected or confirmed COVID-19 case on campus, the college will confidentially notify those who are deemed at risk and recommend appropriate precautions. Departments, faculty, and staff must not share information about suspected or confirmed cases. All occupants of buildings or work area may be notified of positive cases. Based on the contact tracing team's risk assessment, individuals will be notified on a case-by-case basis. College spaces may be closed temporarily to allow for cleaning if a risk assessment determines that cleaning and/or disinfecting a space is necessary. Although you might hear, discover, or suspect that you were in the presence of someone infected with COVID-19 or visited a space that was occupied by someone with COVID-19, it does not necessarily mean that you are at risk. There are many variables that determine if an exposure will result in an illness. Understanding what symptoms an individual was exhibiting, how long were others in the presence of the sick person, and the intensity of contact, that is, proximity, activities, and duration of the contact, are some things that can impact your likelihood of contracting the illness. The contact tracing team will take all of these factors into consideration when determining who else may be at risk on campus. Reynolds has developed a variety of resources to assist our community during this challenging time. The college's public website, reynolds.edu, updates regularly the COVID-19 response page. Details about Reynolds' plans and precautions for returning to campus are outlined in the college's reopening plan available online on the COVID-19 response page. In these challenging and unprecedented times, it is important each of us understand the precautions that are needed to protect ourselves and the critical role each of us play in mitigating the spread of COVID-19 within the Reynolds community. Please read the Acknowledgement of Completion carefully. This will ensure you fully understand the basics of COVID-19, how to protect yourself, the precautions the college has implemented, and your responsibilities in limiting the spread of this disease. With the completion of this training, I acknowledge the risks involved in physically being on Reynolds Community College campuses during the COVID-19 pandemic. I understand the purpose of this training is to enhance my general awareness of the COVID-19 risk and the necessary actions required to minimize my exposure. Some of the risks include, but are not limited to, illness, severe bodily harm, and death. The dangers and risks covered in the training are not exclusive, and I realize other significant risks and dangers may be present. In addition, I understand my responsibilities while working or attending classes on Reynolds campuses include, but are not limited to, performing continuous hand hygiene, wearing a face covering, physical or social distancing, and self-reporting any concerning signs of illness and/or positive COVID-19 test results. I understand that there is no guarantee that I or others will not become infected with the COVID-19 virus, but I pledge to follow Reynolds public health and safety precautions to help reduce that risk. Thank you for doing your part to keep the Reynolds Community College healthy.